My name is Catherine, and I've been living with uncontrolled gout. I've become a peer mentor where I can share my story with other people. I started using a cane because my walk became unsteady. I had a hard time riding, gripping things, standing. When my rheumatologist diagnosed me with uncontrolled gout, I'd never heard of it before. He said, "You have uncontrolled gout because the medication I had prescribed you is not effective." Once I was prescribed Krystexxa, I realized there was hope for me. The peer mentor program is a way to communicate patient to patient, just everyday people that need help with uncontrolled gout. Peer mentors are available for patients before they start Krystexxa, and they can also contact peer mentors after any appointment. They may have questions and want more information and peace of mind. I've spoke to quite a few people across the United States in different stages of uncontrolled gout, but they all had the same concern: will Krystexxa help me? The more I talked about having uncontrolled gout, the more I wanted to help other people and to share my story. I had a woman contact me. Her doctor didn't have a lot of time to spend with her. She couldn't understand the vocabulary words, the symptoms, and left the doctor's office with more questions. She told me that she was about ready to give up. By the end of the conversation, she had hope that Krystexxa was going to help her. It helps talking to a peer mentor because they're going through the same thing you are. Most of it's sadness and confusion, and I answer any questions that they have and give them some hope. That's how I humanize Krystexxa. I put a voice with it. How a patient can access the peer mentor program: you can go on the website of Krystexxa, and they will put you in contact with a person, and you can get your questions answered. I hope that our peer mentor program expands the knowledge, that they have somebody that can listen to them and explain in day-to-day language, where there's some hope and help for them with their gout.
Important safety information. What is the most important information I should know about Krystexxa? Serious allergic reactions may happen in some patients who receive Krystexxa. These allergic reactions can be life-threatening and usually happen within 2 hours of the infusion. Krystexxa should be given to you by a doctor or nurse in a healthcare setting where serious allergic reactions can be treated. Your doctor or nurse should watch you for any signs of a serious allergic reaction during and after your treatment with Krystexxa. Tell your doctor or nurse right away if you have any of these symptoms during or after your treatment with Krystexxa: wheezing, shortness of breath, cough, chest tightness, chest pain, or trouble breathing; dizziness, fainting, fast or weak heartbeat, or feeling nervous; reddening of the face, itching, hives, or feeling warm; swelling of the throat or tongue, throat tightness, hoarse voice, or trouble swallowing. Who should not receive Krystexxa? Do not receive Krystexxa if you have a rare blood problem called glucose 6-phosphate dehydrogenase, G6PD deficiency, or favism. Your doctor may test you for G6PD before you start Krystexxa. Have had a serious allergic reaction to Krystexxa or any of its ingredients. See the end of the medication guide for a complete list of ingredients in Krystexxa. What should I tell my doctor before receiving treatment with Krystexxa? Before you receive Krystexxa, tell your doctor about all of your medical conditions, including if you ever had any heart problems or high blood pressure, are pregnant or plan to become pregnant. It is not known if Krystexxa will harm your unborn baby. Talk to your doctor if you are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed, It is not known if Krystexxa passes into your breast milk. You and your doctor should decide if you will receive Krystexxa or breastfeed. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Do not take any other uric acid-lowering drug, such as allopurinol, febuxostat, Uloric, or probenecid, while receiving Krystexxa. Krystexxa is recommended to be given with another prescription medicine called methotrexate. Krystexxa may also be used alone. You and your doctor will decide the treatment that is right for you. Prior to your treatment with Krystexxa, your doctor may give you medicine to help reduce your risk of getting gout flares or an allergic reaction. Take these medicines as directed by your doctor or nurse. Your doctor will also test your uric acid levels prior to each treatment to monitor your response to Krystexxa. Your gout flares may increase in the first 3 months when you start receiving Krystexxa. It's important to understand that this is happening because Krystexxa is breaking down uric acid in your body. Do not stop receiving Krystexxa even if you have a flare, as the amount of flares will decrease after 3 months of treatment. Your doctor may give you other medicines to help reduce your gout flares for the first few months after starting Krystexxa. What are the possible side effects of Krystexxa? In Krystexxa clinical trials, the most common side effects of Krystexxa, when given together with methotrexate, were gout flares, joint pain, coronavirus disease 2019, COVID-19, nausea, and fatigue. The most common side effects of Krystexxa were gout flares, allergic reactions, including infusion reactions. See, what is the most important information I should know about Krystexxa? Nausea, bruising, sore throat, constipation, chest pain, coronavirus disease 2019, COVID-19, and vomiting. This is not a complete list of all possible side effects. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/safety/medwatch or call 1-800-FDA-1088. For additional important safety information, please see the medication guide and discuss with your doctor. Use. Krystexxa, pegloticase, is a prescription medicine used in adults to help reduce the signs and symptoms of gout that are not controlled by other treatments. Krystexxa is not for use in people with too much uric acid in their bodies who do not have symptoms, asymptomatic hyperuricemia.